Hi, welcome to MedEvolve's Workflow Automation Panel Discussion. I'm Michelle Masters, and I'm the Vice President of Workflow Automation with MedEvolve, and will be the moderator for our discussion today. I'm joined by leadership from three of our outstanding practices across multi-specialties, including orthopedics, ophthalmology, and urology. In today's discussion, we're going to be covering how these practices chose to use workflow automation, some of their experiences, and how they anticipate this to impact their business and experience in the future as well. At this time, I'm going to ask each of our panelists to introduce themselves, and then we will get started with our discussion.
Matt Chapman, Revenue Cycle Director for Key-Whitman Eye Centers in Dallas.
My name is Teresa Hammock, and I am the Office Manager at South County Urological in St. Louis, Missouri.
My name is Gene Austin. I'm the Chief Executive Officer of the Columbia Orthopaedic Group, a 27-physician orthopedic practice in Columbia, Missouri.
Thank you guys so much for joining us today. So our first question is, what were you doing prior to using workflow automation? So meaning, how were you determining the work that your staff was doing and how they would follow up on accounts and or maybe financially clear them? Teresa, I know you're working with our financial clearance portion of the workflow tools, and then Matt, you and Gene are also working with the insurance AR follow-up.
Correct, yeah. Previous to implementing the workflow module in MedEvolve, what we would do is the AR staff would go into the insurance collections application, pull all of our outstanding claims up that way, sort them, filter them. It would pull a large list up, and then we would kind of, export those out into Excel, and then they would work a list manually like that, or they would leave it up on their screen and just kind of go through the list and try to resort and refresh to go back and forth different ways to find different groups of claims that they wanted to look at. So very tedious, cumbersome, and took a lot of work to do that.
Yes, on our financial side, what we would do is actually print a schedule and go through that schedule on a daily basis, a couple of days before the patient was due in the office. And we would verify insurance, obtain referrals, and make all those phone calls, initiate all of that. But then once the patient arrived at the office, we would verify demographic information, update insurance information when the patient was already here in the office. So again, it was a very tedious process, not very trackable, and which led to things sometimes falling through the cracks.
Our experience was similar to what Matt has described, in that it was a fairly manual process. Frequently involved work list sorts in Excel, try and come up with priorities. While the process had some degree of effectiveness, it really left itself wide open for each billing follow-up person working the way they wanted to work, when they wanted to work, and how they wanted to work. And so there was a fair amount of variability in the effectiveness of our staff.
I'd like to echo Gene. I didn't make that point, but I experienced that as well. I'd kind of set aside a project and say to my AR staff, I'd like you to look at this. And then a week later, I'd follow up with, how is this coming along? Come to find out, they're like, well, we decided to change course and do something else. And I'm like, well, that's not really what I wanted you to do, but okay, so I experienced the same thing as Gene mentioned.
So it sounds like there's a lot of manual processes and maybe lack of transparency and insight into what the staff potentially were doing, or a very manual process even for you to be able to track the staff and gain that insight to understand where you were at with your business practices as well. So with that being said, is there any benefits that you can identify that you've achieved through the staff? And, are there any biggest differences that you've noticed with the processes as far as implementing the workflow automation tool? Matt, we'll start with you.
A few. I was really excited to implement this in this practice. I guess one of the first things that I was happy about is getting to our denied claims faster. Allowing us to pull out the denials, and especially a lot of times we'll receive remittance several days before the EFT hits our bank account, so being able to work those claims before we even have a real denial, zero pay or underpay for that check or whatever it may be, getting to those denied claims faster has helped us a lot. Weeding out claims that we don't need to work. There may be some type of adjustment code or denial code that doesn't really require our attention, and so we don't have to sort through lists of claims and look through Excel spreadsheets of patients where there may not be work due on that claim. Again, tracking progress of my AR staff, being able to set up lists that I want them to work and want them to see, and pulling out claims and things that I don't want them to work on or I don't feel is a priority. Being able to help, segregate lists of claims based on what an AR representative's workflow is, their skill level, their experience. Certain people, for us, we're ophthalmology, so certain people may be of a more medical background and not really a vision plan background, and have other people that focus more on vision plans. So I pull those out and I assign those just to them, and that's what they're good at, and they handle just that. Better visibility. I can just track things better, see things better, control things better, and that's really what it's about, I think, for me.
Very similar sentiments on my side here with the financial clearance program. Since having this in place, we've completely changed the way that we receive patients. We do everything 2 to 3 days prior to the patient coming into the office. So that means we log into the financial clearance portal, and at a glance, we can see who's been cleared, who hasn't been cleared, why. Very specifically, there's notes on there. So when our patient arrives at our office, everything's been done. Co-pays have been collected, previous balances have been collected, insurance has been verified. Everything is ready to go to where when the patient is here, we can focus on that patient's care and treat that patient that day and not have the delays at the front desk for missing information or updating information. So that has really helped us with our denials, because we know before the patient ever gets here, there's not any unforeseen issues that we're dealing with at the last minute. So it's helped reduce denials, it's increased front-end patient revenue collections, and just has helped tremendously with the efficiency of our office.
Teresa, it sounds to me like you're saying it kind of creates more of a concierge experience when they first come in as a patient to that front desk. And it's more of a hi, Miss Masters, we're so glad you're here type of a conversation versus trying to get through all the tedious checks and balances and paperwork that sometimes offices and patients can experience on both sides.
Exactly. And it impacts our patient flow. It is so much smoother now because we can see the patient at their appointment time and not wait for them to finish filling out their paperwork or waiting for that referral that somehow may have got past one of my insurance people. So it really has made a huge impact on our practice.
Do you feel like it's impacted your patient satisfaction and also maybe the physician and employee satisfaction as well from that standpoint?
Absolutely. The patients are really excited to get that out of the way before they even come in. They don't want to be, especially now in the world that we live in with COVID, our waiting room isn't even open anymore. We're not gathering people around to fill out paperwork. So this program has really helped us, streamline the entire process. And any questions, patients know before they come in what they're going to owe. It's collected. They don't have to worry about bringing their money. They're just there for their care, and they can focus on, thinking, okay, what am I going to tell the doctor when I get there, and not have to mess around with all of the, financial things when they're really worried about more important things to them.
Great. Thank you. Jean?
I think for me, it comes down to 2 words, and that's efficiency and effectiveness. Mm-hmm. AR follow-up in the medical industry is a hard job. Anybody who's done this for any amount of time knows that there are a whole lot of rabbit holes that things can go down. And what this interface has provided for us is a tool where, as we were saying earlier, we can help organize the priorities of our staff, who are all good people. They all have high skills. They all work hard. But what we're able to do is to help them organize their workflow based on the priorities that management sets. And as a result, it just maximizes their efficiency and their effectiveness. So instead of coming in, there's a joke that says, I've got this routine I go through whenever I start to write a paper, and I go get a cup of coffee, and then I go get a donut, and then I go do something else. I'm not saying that would necessarily be the habit of our staff, But I'm sure that there have been times when, okay, this is a really hard claim. I'm going to go get a coffee and I'm going to go get a donut and I'm going to get really psyched up to work on this claim. What we have been able to do with workflow is management sets the priorities and we present them with the work and basically allow them to be as efficient and as effective as they're capable of being. So it's made a significant difference for us.
Gene, do you feel a greater sense of security as far as you and the board and the physicians with the strategic vision that you have for the practice, that with this being able to present the work to the patients and the employees, do you feel like they're following through and, maybe staying the course a little bit better with your vision?
That is certainly the path that I'd like to think that we're headed down. Certainly the mantra that we've had for this year with all of its other challenges is we want complete transparency and complete confidence in our revenue cycle management processes. And so for the physician, they look in and they've got 30 or 40 patients that they're going to see that day. And all of a sudden, they're going to see those 30 or 40 account balances. Well, what's the status of this? Regardless of the fact that the AR follow-up team may be looking at thousands of balances. From a physician standpoint, there are 30 or 50 that really matter today, and those are the ones that are right in front of him. So in terms of developing that transparency and that confidence in the process, I think workflow has been a very impressive tool in helping us move down that path farther than where we were before.
So how did you handle the change with your staff? So meaning what maybe are some things that you did to prepare your staff for the change with workflow automation from a very manual process that they were doing before? Are there any particular maybe pointers or things that you might share with leadership, kind of tips of the tricks of the trade to think, I wish I would have thought of this, or I wish maybe I would have known that this might be a challenge with the staff, to kind of think through some of those processes? Matt, we'll start with you.
Sure. I feel like I'm very lucky in the sense that even prior to COVID, we're a very progressive practice, and my staff is used to constant change. So I didn't really have to sell them on it, but it does take some discussion, to sit down and explain and try to impart with them what the benefits will be. And I think, as Gene mentioned, it is a hard job, and when you sit and you work claims all day long, it can kind of beat you up. But, and I think it's the way you present it to your staff. And so I think once you can show them that this is going to make their job easier, faster, I think they'll take to it a little bit better. So, implementation here wasn't hard at all. It was easy, relatively speaking. I had great support from MedEvolve, so that helped tremendously. The real pointer, I guess I could say, is that spend some time, if you're going to implement something like this, spend some time beforehand and start thinking about all of your adjustment codes, all of the different ways that you feel like you want to, segregate your claims buckets for your different AR staff, and take some of those things into account so that you put your best foot forward when you get the setup started. It took probably about a month or so after, getting this thing rolled out to kind of tweak back and forth certain things, so I felt really comfortable with it. But that would be my only pointer, is to make sure you go through and really spend some time thinking about how you envision this before going forward. That way you don't feel like it's a catastrophe when you first implement this thing.
Matt, did you get a sense from the staff that they had some security in the fact that maybe they weren't missing claims or less stress from having to choose what claims to work or work list or things of that nature? Definitely.
I didn't mention that, but definitely they were very excited. I think, again, like I say, I think it's all about how you present it to the staff. If you present it in a positive way and you describe some of the benefits like that, I think it can be a positive thing. And they were looking for that help. For the most part, we hire very skilled people, and they don't want to waste their time either, so they don't want to waste half their day sorting through claims that they really don't need to look at or sort through or waste time with. And they want to feel productive when they come to work. They don't want to come to work and spend 8 hours and feel like they got nothing accomplished, so we did definitely experience that.
My staff was very excited to learn about this portal that we were getting ready to present them. They struggled through the manual process. It was hard to know where they were, where they left it from the day before, what needed to be done today. very tedious. So when we did our training, as soon as we were done, they were just so excited to get started using the program, and it was just all the difference in the world for them. It did enable them to be more successful, and it enabled me to choose the right person for the right job. You know, it was assigning these tasks. I could be very selective in, you know, my employees, they all have strengths and they have things that, you know, like all of us, we're better at some and not so good in others. So I was really able to strategically pick the right person for that particular job. And it's really just, we see the benefits every day. The staff's happy, I'm happy, I can see what they're doing, what's been done, what hasn't been done, and it's really simplified our lives.
I think I would echo one of the things that Matt said, and that is we had excellent support and rollout with the MedEvolve team. With that said, you know, change isn't always readily embraced in our corner of the world, and I think it probably took about 60 days before some of the folks realized, oh, wait a minute, this, you know, somebody's not after my job, they're really after making me more efficient and more effective. And so once we got past that, you know, that corner, you know, things really started to roll much better. And I think so. It took a little bit before staff were convinced, okay, this really is here to help me. But once we made that, you know, once they understood that point, it got a lot of momentum very fast.
Wonderful. So next, you know, we've spoken a little bit and touched on the world that's new to us with COVID, and obviously so many different challenges that have faced you guys in practice, both from the health standpoint and then also the financial standpoint, which is really what we're talking about and discussing today. How did the workflow help you during this COVID experience and being able to maybe virtualize some of your workforce or just attack it in different ways to get through the process and sustain as much revenue as you could without having huge dips that obviously some of the restrictions that we've all been imposed upon in the experience with COVID naturally would include as well. So Matt, we'll start with you.
You know, when I first implemented workflow, I knew going forward in the future, you know, I was going to have to start thinking about ways to be able to remotely control how we work our AR or accounts receivable, not knowing, you know, that a few months later or 6 months later that, you know, I was going to be forced to do it. But it was good. We had a lot of people that ended up having to stay working from home, and I was extremely glad that I had workflow already implemented, because it just made it so much easier for me to say, oh, great, well, it doesn't matter where you're working from. Same thing can be accomplished no matter whether you're at a different location, you're at home, or actually in the central billing office. It doesn't really matter. So I was glad to have it at that time. You know, and now we still have some people working from home, and it's allowed us to kind of rethink going forward. You know, I mean, the next time I need an accounts receivable person, do I have to look in this area of our Metroplex? Can I look at applications of representatives that will be working 4 hours from here, or maybe in another state? You know, so I think it's really, haven't gotten there yet, you know, but it's really kind of expanded my options to where I'm thinking, wait a minute, you know, I can do some really cool stuff now, other than just you know, COVID or whatever it may be. So definitely has me thinking, and I think has opened up some opportunity for me.
Awesome. Did you have any fear when some of the COVID pieces started occurring and things that you would lose any productivity because you had this option already for some of this virtualization?
Yes and no. No, in the sense that I didn't have any fear that there was going to be an issue with the product itself or people understanding how to use it remotely. The fear was more of a fear of the personnel themselves. You know, are they the kind of person that can stay productive working from home and not be distracted? It was more of that kind of a fear, but I got over that. Everything seemed to be working fine, and I guess I was lucky again in that sense. But And that's something, again, I'll have to think about going forward is, if I'm going to hire somebody that may be in another state or working remotely many hours from here, understanding how to find out if they're going to be productive. And, this workflow will help me monitor that productivity. To make a point is that one of our employees that went to work from home when COVID started, her husband ultimately ended up losing his job due to COVID, and he could not find a job in the area. And we're from Texas, but he ended up finding a job in Florida, and they just recently moved to Florida, and she's still using workflow from Florida and just as productive as she was when she was here in the office. So that's worked out really nice.
Wonderful. Teresa?
Yes, we have really learned how valuable the system was when we were forced to stay home for a while due to COVID, and we really didn't miss a beat. We were able to continue with our daily financial clearance processes, even though we weren't in the office. So it was a little bit different initially working from home, but the processes went on and patients were cleared, and we were seeing patients more virtually than in the office at that time, but it was very seamless, and it was easy for me to monitor that these things were done and taken care of, and we were able to just kind of slide through on that. That was one aspect that I really didn't have to worry about with everything changing on a daily basis during the height of the crisis in the very beginning when things were changing very rapidly. I had this solid platform to fall back on. So it was very reassuring to me to know that, we didn't have to worry about reinventing something. It was already there and just fell right into place.
Amazing. It sounds like it allowed you maybe to focus more on the health of your employees and your patients that maybe were coming into office versus having to, as you mentioned, create a methodology to still make sure that these processes got done in a very challenging and different time and actually places in which people were having to perform them.
Absolutely. It provided us the flexibility to focus on that and focus on keeping our patients safe and keeping our staff safe, and while still taking care of all the day-to-day business as usual.
One of the advantages of living in the heartland is, COVID really started on the coast and worked its way in, and so we had a little bit more time to adapt to what were the changes that COVID was going to wreak on our business operations than some of our colleagues in either the metropolitan areas or on either coast. But for us, it really has provided us an opportunity to redefine how work is done and the way work is done. And so from that standpoint, we didn't experience the same process disruption that we might have otherwise. Whether it was somebody, we had begun working at home earlier, whether due to COVID, whether due to staffing constraints or whatever, we already had a foot down that, down that path. And so for us, it was having the technology and the capability simply made a process that we were already heading toward just much easier and much more efficient.
Wonderful. So kind of, I guess, to follow up on this, as leaders, you are challenged on a daily basis, and then also, time of year. I know you're starting to think towards next year and planning and budgets and, all the different things that go into running your practices. And you really start thinking, what is our strategic vision for next year, the next 5 years, 3 years, whatever the case may be? Does this technology and this automation allow you or even change how you start to walk down a different path, even with that strategic vision? Something that maybe you never thought was possible now comes into the realm of possibility. And then how can that continue to move the practice forward? So is it a virtual workplace, as you've all kind of mentioned, maybe hiring from, other areas of the country where maybe there's some different talent that you don't have readily available or even readily available at this point in time in your area of the country? Or do you use it as incentives? Maybe it's one day they get to work from home or, a week. And, how does that look? And what does that allow you with this technology as well?
It definitely has made me realize that pretty quickly that I don't want to sound negative here, but I need less AR staff. I don't really need as much staff. They're way more productive. or they can dedicate their time to other things that I would like them to do, because it doesn't take them as long to stay on top of our receivables. Strategically thinking that gives me more options, and either using less staff or using the staff that I have in a better way. Specifically going forward here, you talked about incentives. I have an employee that's about to come back from maternity leave who was a full-time in-office employee. And, I just got off the phone with her today, matter of fact, talking about, when she's coming back and her plans going forward. And she mentioned to me, hey, I'd like to try to work something out where I can work from home a couple of days a week. And, instead of me ho-humming about, I don't think I can do that, I have that option now. I can say, okay, great. Well, let's get some training out of the way, and I think we can manage that, so it's definitely an incentive for employees like her to want to stay here, who's a good employee, a good long-term employee. So.
Well, for us, we are a 3-physician practice, so we try to operate as lean as we can. So if I have an employee who is out for a day, for 2 days, it can really impact the rest of the staff. I just had an employee recently who her family went through a COVID outbreak to where her husband had COVID, and then a week later she got it, and a week after that her daughter got it. So my employee was out for 5 weeks. If I did not have this automation, that would have really been a lot of extra stress on everybody else there. But because I had that, she was able to maintain her work at home throughout the entire 5 weeks. And, everything just went on as if she was here in the office. So for us, it definitely opens up the possibility of having people work from home, but also takes out that dread when you have people calling in due to illness or what other emergencies arise, vacations, whatever. It just made it a lot easier for everyone else to not have to take on that load on top of their own. So it really worked out well for us.
Wonderful.
I think for us, as we talk about a transition from a more remote workforce, the biggest thing that this has enabled us is just the whole idea of metrics. We had, when we started sending staff home a couple of years ago, we had physician pushback from the standpoint, well, how do we know what they're doing? And the comeback was, how do you know what they're doing when they're in the office? Well, at least I can see them and they look busy. Well, okay, that's great. Looking busy, is not a substitute for being productive. But so one of the things that workflow has helped us to do is identify those metrics and measure those activities and behaviors that really are efficiencies, so that it's not just a matter of somebody, hey, quick, look busy, here comes the boss, but to help us identify and measure and manage for people, these are the things that we need you to do. And when you do these things, you're really efficient, you're effective, it's good for the practice, and ultimately it's good for you as an individual. And so one of the things that it has been very helpful for us is to further that metric development in terms of what's the vocabulary, what are the tools, so that now we can sit down with physicians and very comfortably say whether somebody is around the corner or on the other side of town, we know exactly what they're doing. And we have a much better handle on their efficiencies and productivity than we ever have had in the past.
That's great. So that concludes our questions for today. At this point in time, first and foremost, I want to thank the panelists for their willingness and their candidness to share with the rest of our MedEvolve clients what workflow automation has done for them and the journey that they have been on so far with this process and with this technology. At this point in time, we would like to open it up for questions and answers to the rest of the group that are participating in this virtual user summit.
All right, and here we are with our panel for some live Q&A here. So definitely, if you have any questions, enter them in the chat. We do have a couple, so I will go ahead and ask those. And I know we actually discussed a few while we were sitting here in the background, but let's see. Right now, our staff takes a lot of time organizing future appointments and prepping for eligibility, authorization, and funds collecting. It sounds like this would save a lot of time. We often have patients showing up and eligibility was not really fully reviewed or authorization is not on file. This will clean that up, right?
Teresa, I'm going to let you field that one since your team is doing the most with the financial clearance. I think it'll be more meaningful.
I'll be happy to.
Of practice using it.
Yes, the answer to that question is definitely yes. It will put everything that you need to do up in the forefront, and you will know exactly what's been done, what needs to be done, so you do not have those delays at the front desk once the patient's there. So it's a very good tool to streamline the whole check-in process. And as I stated earlier, you know, we do that 2 to 3 days before the patient's appointment. So when they show up to our office, we're ready to see them. So it takes all the guesswork out of it. You have no surprises the day of.
Great. The other question we had was, when was workflow rolled out? Was it available from the start? Was the financial clearance portion available from the start?
So with workflow, we actually rolled out the product about 2.5 years ago, developed it internally first for our own RCM services, just to become more efficient and effective with how we were working our billing for our clients that we do that for. Financial clearance came a little bit later, but it is something that is available to workflow clients that are coming on today and that are using it. So it is something that we will take a little bit of setup. It's a little bit more unique than the insurance and patient AR, but something that we work very closely with clients to make sure that we can get that set up and then make sure the staff is trained as well accordingly.
Okay, very good. Again, if you have any questions, enter them in the chat. I was just, you know, I figured I would ask you this question. It seems like it may clear up some things based on some of the other questions that were asked before, but what's the difference between, you know, the eligibility, the patient estimator, all the stuff that's available in the native PM versus the actual financial clearance workflow?
Yeah, great question. So our products do integrate very well together, and everything that comes into workflow does originate from the PM or our different ancillary products, such as our Practice Insight, EDI solutions as well. So we do get that information coming into workflow, and it's fed into there. What workflow is designed to do is to really organize that information and make it more efficient for the staff to be able to access it. It is a cloud-based version, so as long as you have an internet connection, you can be anywhere in the world and get in and do a lot of the functions that need to occur during billing and or prior to the patient coming in. So for example, as you mentioned, Ashley, the eligibility and those different things, we're pulling those responses across from the PM and what we get back from that in the Practice Insight and with that. So we're able to see that information and be able to present it in a way that is just very clear to the end user to see that. So it does overlap. It's just a matter of workflow being able to say, yes, someone physically checked the eligibility. Someone physically opened up the insurance response and read what the copays are, what the deductibles are, and is able to look at that. They're able to say, someone called the insurance company and said, does a authorization required for a particular procedure? Do we need to call a PCP to get a referral for this if it's a specialty? And so it checks those off in the financial clearance piece of it, and it's able to say, yes, we've done this. And then the artificial intelligence that we use with our analytics on the back end says, well, Michelle Masters said I obtained an authorization for this procedure. However, when we processed the claim, we received a denial. Well, why did we get a denial for an authorization if we obtained it prior to? So we're able to really start looking at that and seeing where do we need to have some retraining, where do we need to push some efficiencies back upstream, and how we affect and do our processes. Okay.
Very good. So obviously, I know not everybody's on the financial clearance workflow on this panel, but and you're all from different specialties. So I'm sure that since you are from different specialties, I'm sure there's some customization required to set up the workflow for it to fit with your practice and stuff like that. Just out of curiosity, what are some ways that you all were able to customize it to fit with your practice's workflow? Start with you.
I'll start.
Okay.
We're an ophthalmology, so we have a large Medicare base. So when I'm setting up my claims workflow, I like to kind of separate some of our Medicare patients from some of the commercial payers that cause a lot of difficulty for us. So that's kind of how I have used it to customize it for myself. I'll normally put my more experienced claims representatives on the certain payers that I know are going to, cause more trouble, and that's what I use it for. I also like to exclude a lot of the claims that I know through denial codes don't require work at this point in time, so I can get to the claims that really require attention faster.
For us, we're an orthopedic practice, and we're at the point of going live earlier in the year. And for us, we're enjoying the fact that it helps to organize, simplify, and enhance efficiency of our team. We've got a good team that follows our AR. By the same token, it helped us to be more efficient in how we monitor workflow and how we measure, and more follow-up information. So I think as time goes on, we will probably become more take advantage of more of the customization. But to this point, it's been taking advantage of being more organized, being more efficient, and beginning to get metrics that we didn't have ready access to before. You made a comment earlier that years ago, the Canon Camera Company had a sales slogan that said their equipment was so advanced it was simple. And I think the same thing can be applied to workflow. With our experience so far, it has taken us a long way in terms of being able to manage the comparable number of claims, but work them much more efficiently with less hands-on from a staff standpoint.
Great. Teresa, do you have any comments on customization?
Yes, actually, yes. The customization has been very helpful because I've been able to go in and assign specific tasks in the portal to certain employees that, I just can concentrate on the employee's strengths and assign those tasks to those people. So it really gives me a lot of flexibility to make sure that I am choosing the best person for the job. So it increases all of our responsibilities to the employees, where they are accountable for the tasks that they've been assigned, and it's made everybody work a little harder, a little better, a little more confidently, knowing that they have all this information at their fingertips also.
Great. And we do have 10 minutes left, which I don't know if this will take that long, but I just thought I'd ask, looking into 2021, do you have any goals for next year regarding workflow that you've kind of been thinking about implementing, or just future thoughts regarding workflow automation? Matt?
Personally, I'm excited about I like to get in there and get real specific with it, start carving out denial codes and things like that. And I've done a really great job, and my team really has done a great job so far. I think this next year I'm going to really fine tune it. And so that's what I'm excited about looking for. Just every minute that they have to work the claims, I think, is really important. And so the less time they waste doing stuff that doesn't make sense, then that's what I want to get them to do, is where they can make sure that everything they touch has been focused to something that needs to be worked. And that's what I'm excited about.
I think I'd parrot the same thing that Matthew just said. In terms of our goals are simply to become even more, make more robust use of the tool, some of the information that we're beginning to get, we can act on. As Matt said earlier, you measure it to improve. And I think that's the thing that we're most excited about is, not only being able to help staff work more efficiently and more effectively, but then how do you act on the metrics and the information that you've got coming in? So from a financial clearance standpoint, from a claim follow-up standpoint, we're beginning to see some very positive move in some of the metrics that, give us, reason to be optimistic about what we can do going on into 21 with, learning a little better how to use the tool and making, setting a little more robust goals for ourselves.
Very good.
And for us also, for 2021, we want to keep using the tool, keep fine-tuning it, and discovering how we can continue to grow and advance with the tool and become even more efficient and effective.
Very good. Michelle, I can't hear.
Sorry.
Okay.
I'll add a couple of comments from our other clients that use the workflow solutions as well. One of the goals that they have is really using the activity, action, and status codes and the productivity reporting that we provide on a weekly basis to drill down into some of those trends that they're seeing. Where can I move this back upstream? Is it something that I need to talk to a physician about where we're seeing modifier issues or coding issues and do some education around that with the physicians or the coders? Is it something that I need to go back to the front desk folks because maybe they haven't started using financial clearance and now we can implement that and start utilizing that and being able to see the results there? Maybe it's driving down days in AR and attacking just an older bucket of aged claims and what that looks like. And then just additionally being able, and I know we've got an upcoming session with Matt and some of our other panelists on the Power BI analytics, is being able to utilize that information and create very specific workflow and work list to continue to move the needle with the financial piece for each of the practices. I would also kind of echo for us at MedEvolve as an organization, we're very blessed with the workflow clients that we have, that they give us great feedback. They tell us what's working, things that they want to see enhanced, things that will make it easier for the end users. And it's just such a great knowledge base for us to be able to take that information in and continue to make improvements on the tools and continue to have new releases. We just did our latest release the last couple of weeks. We're staging it out across the different clients, and it's all based on feedback that they've given us to enhance the product to make it more beneficial and user-friendly for their staff as well. So
makes a lot of sense. Okay, great. Well, I don't think there's any other questions coming in. So, so thank you all very much for your participation. I appreciate it so much. We all do.
Yeah.
Have a good afternoon.
You too. Thanks a lot.
thanks, guys.
You too.
Thanks.